Riley Quinn had 12 minutes left at St. Bartholomew Medical Center when the windows began to vibrate. The clock above the trauma bay door ticked toward 6. Night shift noise had thinned to a low murmur, a cart rolling a monitor chiming somebody laughing too loudly at the nurse's station. Riley stood by her supply cart, wiping the metal surface even though it already shone. Disinfectant stung the cracks along her knuckles. Her blue scrubs clung damp to her shoulders. She worked in small automatic circles the way you keep your hands busy when there is nothing left to fix. Security to level 1, the overhead speaker said. Escort for Nurse Riley Quinn, badge 619. The words drifted down the hall. A tech glanced at her, then away. A clerk pretended to shuffle papers. No one said anything. Riley set the wipe aside. She slipped the stethoscope from her neck, laid it neatly on the cart. The bell was scratched, the initials RQ etched into the metal. Her fingertip rested there for a breath, pressing into the groove she had carved herself. A deep vibration rolled through the floor. It sounded like thunder under concrete. A stack of bedpans rattled on a shelf. The fluorescent lights hummed louder as if straining. Storm coming in early, someone muttered from behind the nurse's station. Riley lifted her head. The sound did not feel like weather. It had a rhythm, a weight, a pattern she recognized in her muscles more than her ears. The clock kept ticking. 12 minutes. The night before rose up in her mind, a smaller room, thicker carpet, softer voice. Dr. Gregory Hale's office looked like a photograph from a hospital brochure. Polished desk, framed degrees blinds drawn to a tidy line. Between his folded hands sat a thin folder with her name printed on the tab. You performed an invasive cardiac procedure without imaging, he said, without an attending present, without authorization. Riley stood in front of the desk, arms loose at her sides. She had come straight from the emergency department. The smell of antiseptic and sweat clung to her scrubs. There was a brown smear on her sleeve, coffee or dried blood, she was not sure. The patient lived, she said. Her voice sounded rough in her own ears. Hale did not look impressed. He tapped the folder once. That is not what we are discussing. He opened it, scanned the first page, closed it again. We have the protocols, Boucher, he said. We have a chain of command. We do not improvise in ways that expose this institution to unnecessary risk. What you call instinct, I call recklessness. For a moment, the office faded. Riley saw the trauma bay instead. A woman in her 40s. Linda Carr on the gurney. Skin gray, breathing fast. Blood pressure numbers dropping on the monitor no matter how wide they opened the fluids. Jugular veins swollen, heart sounds muffled under the stethoscope. The cardiology fellow squinting at a fuzzy echo image, wanting a better view, while the alarms climbed in pitch. Tamponade, a heart being strangled from the outside. In that room, there had not been time for another consult or another scan. There had only been a needle, a narrow window between ribs, and the weight of all the things that would happen if she missed. Riley felt again the resistance of tissue against the tip, the sudden give when it slipped into the pericardial space. Dark blood filling the syringe. The monitor settling. Linda gasping eyes focusing on Riley as if she had been pulled back from a very deep place. In Hale's office, those details did not matter. Riley could have laid them out for him, signs, symptoms, survival curves. She could have told him exactly how long Linda would have lasted if Riley had waited. She had the words. They lined up in her throat and went nowhere. In another life, in another uniform, she had learned that some people heard only the part where you admitted you broke a rule. Hale watched her for a beat, then seemed to decide for her. You have a history of this kind of behavior, he said, acting as if guidelines are suggestions. That cannot continue. He slid a single sheet across the desk. Effective immediately, he read, though she could see the words for herself. Your employment with St. Bartholomew Medical Center is terminated. Human Resources will process 2 weeks of severance. The record will state resignation for personal reasons. The word terminated sat in the middle of the page in smooth black type. For a heartbeat, she saw Linda instead alive in a bed downstairs because Riley had not stood still and waited for permission. She picked up the paper. Her fingers did not shake. She folded it in half, then in half again, until it was a small, stiff square in her palm. Where do you want the badge? She asked. Hale blinked. He had been ready for excuses or fury or tears. Something he could hold against her. Security desk on the first floor, he said. They will have an exit checklist. All right. She left his office beneath a poster that read, Teamwork Saves Lives in big blue letters. On the way back down to the emergency department, she let herself slow. Not because her legs were tired though they were, but because every doorway she passed held a story she was not ready to abandon all at once. At the cardiac step-down unit, she stopped in front of room 412. Through the glass, she could see Linda Carr asleep under a thin blanket, an oxygen cannula resting beneath her nose. The monitor over the bed traced steady green lines. In the chair beside her, a little girl slept curled in on herself, one hand still touching her mother's arm. Riley lifted 2 fingers, touched them lightly to the glass. Then she moved on. At the nurse's station, she took a stack of yellow sticky notes from her pocket. Her handwriting was quick and sharp. Mr. Shaw gets anxious around shift change. Sit with him a minute. Mrs. O'Reilly needs pain meds 30 minutes before PT. She stuck the notes to the edge of the computer monitor where the day shift could not miss them. The staff lounge door stood open at the end of the corridor. Inside, the coffee machine gurgled. The air smelled of burnt coffee and reheated takeout. Along one wall hung a wooden frame with a brushed metal plate that read, "In memory of those who gave their lives in care of others." Photographs filled the space inside the frame. A nurse in cartoon print scrubs, a paramedic in a reflective jacket, a doctor in a white coat, and in one corner a woman in army dress blues. Riley stepped closer. The woman in the uniform had her hair pulled tight, chin lifted, eyes fixed on some point beyond the camera. The name on the plate beneath her picture was simple and clean. Captain Naomi Park, MD, killed in action. Al Cotter, Operation Glass Halo. Riley's breath caught. The letters wavered, then steadied. Al Cotter was not a name that belonged on a hospital wall in Denver. Operation names like that did not appear on public plaques. They lived in classified files and in the backs of the minds of the people who survived them. Her hand rose without thinking. Her fingertips touched the glass. It was colder than the room around her. Heat and sand and the high metallic whine of incoming fire pushed at the edges of her memory, pressing through the smell of coffee and bleach. Someone had reached into a sealed chapter of her life and hung a piece of it here under fluorescent lights. Her skin prickled. She let her hand fall back to her side. From somewhere above the ceiling tiles, the deep vibration came again, stronger now. The cups beside the coffee machine rattled against one another. Out in the hallway, the clock over the trauma bay door kept ticking. 11 minutes. The rumble followed her out of the lounge. Riley stepped back into the hallway, the sound crawling along the ceiling, sinking into the drywall. Cups on a rolling cart clinked together. A fluorescent panel flickered, then steadied. She checked the clock again. 10 minutes. The security guard assigned to her stood at the far end of the corridor, leaning against the wall. Young buzzcut badge that read Ethan Clark. He straightened when she looked his way. "You ready to head down, Ms. Quinn?" he asked. "In a minute," she said. Her locker was on the second floor past the staff elevators. She took the stairs, Ethan following a few steps behind his radio, hissing with half phrases she could not quite catch. Second floor was quieter. No visitors, only a few night shift nurses drifting between rooms with clipboards and tablets. The rumble above had softened, but it was still there, a pressure in the air. In the locker room, the smell of detergent and body spray hit her. Rows of gray metal doors, a bench running down the center. Someone had left a pair of Crocs under the bench, one tipped on its side. Riley spun the dial on her locker, opened it. The interior looked smaller than it had a week ago, a folded navy hoodie, a plastic lunch container with nothing inside, a small bottle of lavender lotion. Her stethoscope hung from a hook, coiled neatly. Above it, taped to the metal, was a photograph. Liam stood in the gravel driveway back home in Kansas, one hand resting on the hood of their father's old pickup. 17, a little too tall for his frame hoodie sleeves shoved up past his wrists. The sky behind him was wide and empty. There was grease on his knuckles. His grin looked like there was all the time in the world. Riley reached up and peeled the tape from the corners. She was careful not to crease the picture. Her thumb traced the outline of his shoulder, then the side of the truck. The rumble thickened. The bench vibrated under her knee. One of the younger nurses stuck her head in from the doorway, ponytail swinging. "Do you hear that?" the girl asked, eyes wide. "Feels like an earthquake." "Probably just construction," another voice said from the hall. The floor shuddered. Dust drifted from a ceiling vent. Riley moved on instinct. She slipped Liam's photo into the pocket of her scrub top, grabbed her stethoscope, her badge, the few things that felt like hers and not the hospital's. The light snapped off for a breath, plunging the room into dim gray. The emergency generators caught up a second later, throwing a harsher light across the metal doors. The overhead speakers crackled. "All staff remain where you are and await instructions," a calm recorded voice said. "Do not attempt to leave the building. This is not a drill." The last 4 words pulled the air out of the room. Riley stepped into the hall. Ethan was already there, hand pressed to the earpiece of his radio. "What is it?" she asked. "Not sure," he said. "Command is saying lockdown until further notice." The rumble became a roar. They reached the end of the corridor, where a line of windows looked out toward the rooftop helipad. 2 nurses and a respiratory therapist were already pressed to the glass, staring out. Riley came up beside them. 2 Black Hawk helicopters hung in the sky above the hospital rotors, chopping the dawn light into pieces. They were matte black, no hospital logo on the sides, no bright medic markings. Air washed over the roof in visible waves as they descended toward the helipad. The phlebotomist next to her whispered, Since when does St. Bart's get military transports? No one answered. The Black Hawk settled on the roof, sending loose gravel skittering. Figures in dark gear moved inside the open doors, outlines sharp against the morning. The speaker above their heads clicked again. The recorded voice was gone. This one was live mail carrying the clipped rhythm of someone who had spent years giving orders into static. "This is Captain Alden Pierce with United States Army Special Operations," the voice said. "All staff remain at your stations. Repeat, remain at your stations. Riley Quinn, report to rooftop access. Riley Quinn, report to rooftop access now." The hallway went quiet except for the distant thump of rotors through the walls. A nurse frowned. "Do we even have a rooftop access point?" Ethan turned to Riley. "I guess that would be you," he said a little too lightly. He was trying to make it a joke. It did not land. Faces turned toward her, curious and wary. Some looked like they were seeing her for the first time. Riley swallowed. Her mouth tasted like metal. The call on the speaker had been clear. Not Nurse Quinn, not some generic staff. Her full name repeated like a locator beacon. "Let's go," Ethan said quietly. Riley followed him toward the stairwell at the end of the hall. Behind her, the voices began again in low, tight clusters. "Why are they here for her?" "She was just fired." "Maybe it is a drill." The stairwell door banged open as they reached it. The sound bounced against the concrete walls. 6 soldiers poured through boots, striking the steps in steady rhythm. They were in full tactical gear helmets, vests, sidearms, rifles slung, pointed down. Goggles rested on some foreheads, others had them over their eyes. They spread instinctively, forming a loose perimeter in the stair landing. Small motions settled into stillness. Weapons stayed low but ready. On the right shoulder of each uniform a patch. A stylized bird with wings outstretched feathers like tongues of flame. 7 stars arced above its head. Phoenix 7. Riley stopped dead. The hallway seemed to tilt. For a second, the white paint and polished linoleum blurred into mud walls and sun-baked concrete. Heat rose phantom against her face. Her heart picked up a beat that had nothing to do with exertion. The tallest of the soldiers stepped forward. He pulled his goggles up, revealing dark eyes set in a face that had lost any trace of youth too early. There was a scar along his jaw, pale against brown skin. His gaze moved down the hall, passed over Ethan. The nurses landed on her. Held. "Riley Quinn," he asked. Her mouth felt dry, yes. He nodded once. "Staff Sergeant Cole Maddox," he said. "United States Army, we are here to escort you to a helicopter. We need your assistance." Assistance with what, Ethan blurted. Cole did not look away from Riley. "It is a medical situation," he said. "Critical. They told us to find the medic from Al Qadr." He let the name fall like a test. The air left her lungs. Ethan glanced between them. The nurses shifted, unsure what they were hearing. Riley's fingers curled around the strap of her bag. "I'm not military anymore," she said. Cole's jaw tightened almost imperceptibly. "I understand," he said. "But the man who is the reason we know your name. Colonel Jack Rourke. He is alive because of you. He is not going to stay that way unless you come with us right now." The hallway shrank to a narrow tunnel. Rourke's name dragged other images with it. A room half-collapsed, choking dust, the taste of copper, hands buried in blood that would not stop, his voice rasping curses while she worked. Riley blinked hard. The hospital corridor snapped back into focus. Ethan's hand hovered near his radio. The nurses stared openly now. "You do not have to do this," Ethan said under his breath. She looked at him. "Yeah," she said, "I do." Cole stepped aside, offering her an opening into the stairwell. "Escort is already cleared with administration," he said. "You have 10 minutes before the birds have to lift." 10 minutes. The same number the clock had given her, only now measured in someone else's heartbeats. Riley adjusted the strap on her shoulder. Ethan opened his mouth again, then shut it, something like respect and something like worry battling on his face. "Keep an eye on Linda Carr," she told him. "Room 412. Tell day shift the tamponade is handled, but they need to watch her pressures." He nodded, thrown by the specificity. "Yes, ma'am," he said. She followed Cole down the stairs. The soldiers closed in around them, not crowding, but placing themselves between her and anything unexpected. The rhythm of their boots matched the fading pulse of the rotors above. They reached the top-floor landing. Another set of doors, heavier, led to the roof access. A hospital security officer stood there, trying to look as if he facilitated military escorts every day. "I will take your badge now, Miss Quinn," he said, holding out his hand. Riley unclipped it from her scrub top. The picture on the plastic was slightly faded, corners scuffed. She set it in his palm. He slipped it into an envelope without looking at it. The door opened. Morning wind rushed in cool and sharp, carrying the smell of fuel. The rooftop was a flat spread of concrete and painted lines. The 2 Black Hawks waited with their engines turning, rotors spinning, throwing air in heavy chopping waves. The birds were louder out here, the sound punching into her chest with every rotation. Crew members in helmets and vests crouched near the open doors, signaling with gloved hands. For an instant, standing between the humming building and the aircraft, Riley felt suspended between two lives. The one where she was just a nurse in worn scrubs whose job no longer existed, and the one where she was something else entirely. Cole leaned close enough that she could hear him over the noise. "Ma, Emmy said he has maybe 6 hours. They said you were the only one who has done this before." Riley squinted against the rotor wash. Hair flew out of her ponytail, whipping her cheeks. The edges of Liam's photograph pressed against her chest through the scrub pocket. 6 hours. She climbed into the Black Hawk. The interior smelled of oil and metal and old dust. Jump seats lined the sides, webbing stretched across them. She dropped onto the nearest one, hands finding the straps without needing to look. Cole handed her a helmet with a headset attached. "Put that on," he said. "We will brief you on the way." She slid the helmet down over her hair. The world narrowed to the padding around her ears and the steady thrum of blades above. The crew chief slapped the side of the fuselage twice. The helicopter lifted a clean surge upward that pushed the hospital roof away beneath them. Denver fell away in blocks of glass and brick. The city tilted, then shrank, disappearing into distance as the Black Hawk turned toward the rising sun. Across from her, Cole unzipped a waterproof case and pulled out a tablet. The screen lit his face in pale blue. He tapped, brought up an image. A chest. A heart. A shard of metal bright against the gray. "Colonel Jack Rourke," he said. "Here is what we are dealing with." The image on the tablet was grainy, but Riley did not need clarity to understand it. Cross-section of a chest. The hazy outline of a heart, its muscular curve framed in gray. Just beside it, tucked in a narrow space that should have been empty, a hard shard of white. Metal. Cole held the tablet steady on his knees as the helicopter trembled around them. "Shrapnel came in high and medial," he said into her headset. "Blast in a market improvised device. They controlled the external bleeding, stabilized what they could, flew him to a forward surgical team. They got him through the first night. Then the bleeding started again." He tapped the bright fleck near the heart. "They say it is sitting right about here. Too close to work on without bypass. They do not have bypass." Riley leaned in, eyes tracking the angle of the fragment, the relationship between shadow and brightness. The tablet vibrated in time with the rotors. Her fingertip hovered above the screen for a second, tracing the imaginary path of the entry wound. "Any pericardial effusion on scan?" she asked. Cole swiped. Another image. Fluid around the heart, a thin, dark crescent that was not supposed to be there. "Some," he said. "Not massive. They drained what they could with a needle. Vascular involvement? Probably. They patched a few things. The local surgeon mentioned a lot of scar tissue from an old injury." Old injury. Riley did not need to ask which one. She nodded once more to herself, then to him, and sat back. The harness straps dug into her shoulders as the helicopter hit a pocket of rough air. Through the small round window beside her, the world had changed. The squares of suburbs and highways had given way to wide brown land. No snowcaps, no city skyline, only sand-colored earth and the occasional hard line of a road. Her stomach clenched a quiet, familiar twist. The first time she had ridden into a combat zone, it had been night, and she had not been able to see much of anything until the flares went up. This time there was no darkness to hide it, just dry land stretching out and out. She closed her eyes. The thud of the rotors did not stop. It thickened, wrapped around an older sound, the concussive punch of an explosion too close. Al-Qadr had not smelled like anything at first. Then the dust had settled, and the odors layered themselves one by one. Burning insulation, cooked meat, hot metal. The sharp coppery wetness of blood on dry pavement. Riley had stumbled as they spilled out of the armored vehicle, her boots sinking into a mixture of glass and sand. Heat clawed at her through her uniform. Somewhere ahead, someone was screaming. Someone else was shouting coordinates into a radio that kept dropping out. The building they had been sent to was half gone. One wall sheared away, rebar like broken ribs against the sky. Inside, smoke and dust turned light into a chalky haze. She could barely see her own hands. She had found Rourke by sound, following a hoarse cursing that cut through the rest of the noise. He lay pinned beneath a chunk of concrete that had been part of the ceiling. His chest rose shallow and fast. Red bubbled at his lips. His vest was shredded. The ground around him glistened. "Do not touch that," he had rasped when she reached for the slab. "Not planning to," she had said. There had been so much blood. She had worked with what she had. Field kit spread out on a shattered tile, 2 tourniquets, 3 IV lines, a bottle of saline they had to ration between 3 men. No imaging, only her knowledge of anatomy and the feel of tissue under her fingers. Every time she pressed, more blood slid warm along her gloves. Medevac had been 15 minutes out. Someone had said the words unrecoverable chest wound. Rourke had heard them and tried to sit up, angry at the phrase. Riley had made a choice on the floor beside him. She had used a chest tube as if it were meant for something else. had taken a cautery tool designed for equipment and touched it to living vessels smelling tissue singe while she sealed leaks, had slid her hand between ribs, feeling the heart push against her palm, flimsy and stubborn. She had talked while she worked, not to comfort him, but to keep herself anchored. "You do not get to quit here," she had said. "Not with this many eyes on you. You will never hear the end of it in the afterlife." He had tried to laugh, choked instead. His eyes had stayed fixed on her face almost the whole time, like he was waiting to see whether she would flinch. By the time the helicopter came, his blood pressure was low but stable. 3 others were alive who should not have been. The aircrew had looked at Riley like she was the strange part of the scene, not the collapsed building or the torn bodies. Later, in a beige room with blinds and too much air conditioning, someone had told her the procedure she had improvised was not reproducible. They had buried it in a report no one was meant to read. Now the Army had named it after him. Rourke Maneuver. She opened her eyes again. The desert outside the Black Hawk shifted as they banked. The pilot's voice came through the headset, low and clipped. Approaching Coyote Ridge, 2 minutes out. Cole secured the tablet and clipped it to his vest. The soldiers around them checked their weapons, not with nervousness, but with ritual calm. "You good?" Cole asked her. Riley checked her hands. They were steady, resting on her thighs. The tremor, when it came, usually hit later. "I am fine," she said. He seemed to accept that. The forward operating base rose from the ground like something dropped there by a careless giant. Concrete barriers ringed the perimeter. Inside rows of canvas tents, a few low corrugated metal structures, vehicles parked at odd angles. From above, it looked temporary and stubborn at the same time. The Black Hawk descended in a whirlwind of dust. Brown grit sprayed the windows, turning the world outside into a storm. Riley's body remembered what came next, even before the skids touched. She grabbed the overhead strap as the helicopter rocked with contact. Her heart ticked up once and then leveled. The crew chief slid the side door open. Heat slammed in thick and dry, mixing with the rotor wash. The smell followed. Diesel and burned trash, sweat and antiseptic. Underneath, faint but unmistakable, the iron smell of fresh blood. "Quinn, you are first," Cole said. He had to raise his voice against the noise. She unclipped her harness and stood. The floor hummed under her boots. She jumped down, knees bending automatically to absorb the impact. The ground felt harder than it looked. Dust puffed around her ankles. Someone pressed a set of ballistic glasses into her hand. Another hand pointed toward a gap in the concrete barriers. Riley slid the glasses on. The world narrowed again, this time through tinted lenses. Inside the perimeter, the base beat like a heart under strain. Medics jogged past with bags of saline and units of blood held high. A pair of corpsmen lifted a wounded soldier from a pickup bed onto a stretcher, their faces set. A siren sounded from somewhere, short and insistent. Voices layered over each other in English and something else. Orders, pain, anger. No one was standing still. "Over here," Cole said. He guided her between 2 tents, ducking under a line of hanging IV bags. Shadows shifted against canvas walls as they passed. She caught glimpses of pale faces, gauze, gloved hands. They stopped outside a tent marked with a faded red cross. "This is the closest thing to an OR we have," Cole said. "They are waiting." He held the flap aside. Inside, the light was harsh, the air cooler. The smell of bleach fought for dominance, almost winning. A table stood in the center of the tent, metal and narrow. On it lay a man Riley knew. Jack Rourke looked smaller without his uniform. Hospital gown cut open down the front chest, covered in sterile drapes except where the monitors and lines broke through. His hair, once dark, was threaded with gray. Deep grooves bracketed his mouth. His skin had the flat color of someone whose blood volume had been negotiated too many times. The monitor at his head traced a rhythm that was regular but not comfortable. Riley moved closer. A jagged scar ran across his left chest, pale against the rest of his skin. Her own work. 8 years had turned it into a raised white line, proof that the body sometimes listened to what you asked. Above and slightly medial to that scar, the skin bulged faintly where dressings and tape hid the newer wound. A young surgeon in green scrubs stood on the opposite side of the table. He looked up as she approached. His eyes were ringed with fatigue but alert. "Dr. Henke," he said, offering a gloved hand. "You must be Quinn." "Riley," she said. He nodded, dropping formalities as if they cost too much energy. "We did what we could," he said. "Shrapnel entry here, exit nowhere. It migrated. We controlled bleeding from the obvious sites, packed transfused. He crashed twice last night. We got him back both times, but the numbers are worse each time he dips." He gestured to the monitor. Blood pressure numbers flickered in a narrow, safe range, supported by a cocktail of drips. Oxygen saturation hovered just shy of reassuring. "We attempted a modified version of the maneuver you developed in Al-Qadr," Henke said. "The one they taught as Rourke's. Riley looked at the drapes, the lines, the way his hands hovered over the chest, as if still replaying the procedure. How modified, she asked. Different access point, less scar tissue. His mouth twisted. In theory. In practice, the angle is wrong. He pointed toward the imaginary path inside the body. The fragment is sitting almost on top of the right ventricle wall now. There is old scar adhesions, fresh hematoma. It is like someone poured glue in there and let it set. Riley pictured it as he spoke. Scar tissue like cobwebs, new blood layering over old damage, the small hard fragment perched too close to the muscle that needed to keep moving. If you go after it the way we were taught, Henke said, you will tear something you cannot repair without bypass. And we do not have bypass. The nearest facility that does is in Germany. He will not tolerate that transport. His voice did not shake, but something in it frayed at the edges. Riley looked at Rourke's face. His eyelids fluttered once as if he heard them. It might have been coincidence. It felt intentional. A monitor beeped a warning. Henke turned, adjusted a drip, waited for the line to settle. What are they using to manage the effusion now, she asked. Repeat pericardiocentesis, Henke said. Every time we pull off fluid, we buy a little space, not much. The rate is increasing. Coags? Touchy. We are walking a line. He clots just enough to trap the blood where we do not want it. A nurse to Riley's right held a clipboard. She had cropped hair and tired eyes that still missed nothing. Quinn, she said. Jenna Lee. We were in Phoenix 7 before you rotated out. The voice pulled Riley away from the monitor. She recognized the line of Jenna's jaw, the set to her shoulders. The shaved hair was new. The alert gaze was not. You kept your rank, Riley said. Someone had to. Jenna's mouth quirked for a second, then straightened. Miguel is scrubbed in and ready if you need him. Alvarez is here, Riley asked. In triage, Jenna said. He has been holding the line all night. Riley nodded. For a moment, the weight in her chest shifted from dread to something like solid ground. Familiar names, familiar competence. Henke stepped back, giving Riley room at the head of the table. The monitors reflected green and red in her eyes. The team is yours if you want it, he said. You know this anatomy in a way I do not. Riley studied the lines on the monitor for a quiet count of 5. Heart rate, pressure, oxygen, the subtle dips in the waves that told their own story. She looked at the hollow above Rourke's collarbone where his skin sagged a little from weight loss. Men like him did not sit still when they were healthy. He had never been built to lie on a table and wait. How long since the last drop in pressure, she asked. 40 minutes, Jenna answered. Any more imaging? Riley looked toward a portable ultrasound machine in the corner. Henke shook his head. Battery died. We are on backup power now. We can get you a partial view if we shut down something else. Riley considered that. The whir of fans, the soft hiss of oxygen, the steady tone of machines that kept other patients alive outside this tent. No, she said. Save the power. This is not going to be an imaging kind of procedure. Henke let out a slow breath. You think there is any chance without opening his chest? Not one worth counting on, she said. Silence settled for a moment. The only sounds were the monitors and the soft clink of instruments being arranged at Jenna's elbow. Outside, a distant helicopter took off its rotors, a low drum through the canvas. Riley slid her stethoscope from her neck. The rubber felt hot from the air. She placed the diaphragm gently on Rourke's chest between scar and dressing, listening past the noise of machines. The heart was there, stubborn and regular for now, working against the weight pressing on it. It sounded tired. She straightened. We are not flying him anywhere, she said. We are doing this here. Henke studied her face. His jaw worked once, then he nodded. You will need a modified field pack, he said. We have some hemostatic foam in the supply tent, a couple of vascular clamps that might hold up. Blood is tight. We have O negative if it gets ugly. It is already ugly, Jenna said quietly. Riley met her eyes and saw the echo of an old tent, another table, different wounds. Get Miguel in here scrubbed, Riley said. I want him on anesthesia and pressure control. Jenna, you are with me. Henke, you can assist or you can observe for documentation, but I do not have room for anyone who hesitates. Henke gave a short, humorless laugh. I am fresh out of hesitation, he said. I will assist. Riley looked down at Rourke one more time. His lips moved, maybe forming her name, maybe just air. Her hands flexed at her sides. All right, she said. Let us scrub. The water in the scrub sink ran too hot at first. Riley let it scald her wrists before she nudged the tap cooler with an elbow. Soap foamed thick between her fingers. She scrubbed to the beat in her head, a quiet counting she had learned years ago. Palms, backs of hands between fingers around thumbs, up past the wrist to mid-forearm. The sounds of the tent blurred behind her, muted by the focus of the routine. When she rinsed, the water carried pink streaks from old smears of someone else's blood. The skin on her knuckles flushed red. She stepped back, hands held stiff in front of her, fingers pointed up. A medic waited with a sterile towel. Riley let her dry each arm from the fingertips to elbow, then turned so Jenna could help her into the gown. The fabric settled over her shoulders, light but heavy with what it represented. Jenna tied the strings at the back with efficient tugs. Miguel Alvarez pushed through the flap as Riley slipped her hands into the gloves. He had deep circles under his eyes and a streak of something dark on his jaw. He wore a surgical cap with a faded cartoon pattern that did not match the hardness in his gaze. "So they really found you," he said. "Guess I was not hidden very well," Riley said. Miguel snorted softly. "We have got him on a ketamine drip and a low-dose pressor," he said, switching to business. "Arterial line is in the left radial. Central line in place. I can keep him in the zone if you do not surprise me too much." "I will try not to," she said. They moved back to the table together. Rourke lay where she had left him. The sterile field glowed under the operating lights, a rectangle of possibility cut out of chaos. Monitors hummed at his head, green and white lines crawling across black. Jenna stood at the instrument table, hands ready. The tray in front of her held what they had scrounged that might work: scalpels, retractors, a handful of vascular clamps, a small device about the size of a soda can labeled hemostatic foam, do not use in closed spaces. Riley nodded at it. "That the only one?" she asked. "Got 2 more in reserve," Jenna said. "Command likes to save them for limb bleeds." "They can complain later," Riley said. Hanky came to her side, gloved and gowned. His eyes had sharpened. "Walk me through what you are thinking," he said. Riley looked down at the draped chest, then at the mental map in her head. "We cannot chase the fragment like it is a static target," she said. "It is moving with every beat. If we go in blind and try to grab it, we will tear the ventricle or the pericardium. He does not have the volume to survive that." Hanky nodded once. "We start by creating a better window," she said. "Open enough to see what we are doing, not so much that we lose heat and control. Then we manage the effusion and the acute bleeds we can find." She pointed at the canister on the tray. "After that, we use the foam. Not to fill the whole space like in a limb. We build a cushion around the fragment, limit its range of motion, give ourselves something to work against, so when we pull it is not slicing." Hanky raised a brow. "You trust that foam inside a chest?" he asked. "No," she said. "But I trust my hands to keep it where it needs to be. The alternative is letting that thing dance on his heart until it wins." Miguel adjusted the ventilator settings, eyes on the tidal volume. "You have got about an hour of him tolerating this strain before his kidneys start complaining," he said. "Less if you make him bleed." "Then we should get moving," Riley said. Jenna stepped closer with the scalpel handle offered in the correct grip. Riley took it. The weight was familiar. The tent seemed to pull in around the table, the edges of the world falling away until there was only this rectangle of flesh, these sets of hands, and the steady percussion of machines. "All right," Riley said. "Let us begin." She opened along the old scar, first following her own line. The tissue there gave a little easier, softened by past healing. Underneath, the newer adhesions clung. She worked through them carefully, recognizing what had been her work and what had been Hanky's. Every layer had its own feel. Skin, fat, fascia, muscle, each with a different resistance. The smell of cauterized tissue rose in faint waves as Hanky followed with the electrocautery tool, stemming smaller bleeds as she exposed them. Miguel called out numbers in a low, steady voice. Pressure 90/50, heart rate 98, sat 94. Riley parted the ribs with a retractor just enough. The metal creaked softly as Jenna turned the crank. The heart came into view, a damp muscle working stubbornly under stress. There was scar tissue everywhere. It clung in white strands between the heart and the chest wall, tethering structures that should have glided past one another. Newer blood pooled around those tethers, dark and viscous. Riley exhaled through her nose. "He has been busy," she said. She found the pericardial sac and nicked it with the tip of the scalpel. Fluid welled up dark and under pressure. Jenna was there with the suction, pulling it away as fast as it came. As the effusion cleared, the heart had a bit more room to move. The beat became slightly stronger under her gaze, less choked. "Pressure 98/60, Miguel said. "Nice." "Do not jinx it," Jenna muttered. The fragment was not visible yet. Riley could feel where it was from the way the heart wall bulged in one area, the subtle change in motion on each contraction. It was close, just under the surface of muscle that had already been through too much. She held out her hand. Jenna placed a long, narrow probe in it. Riley touched the probe to the area gentle as she could. The metal vibrated against something harder underneath, a tiny click transmitted through layers of tissue to her fingertips. "There you are," she said quietly. Now came the dangerous part. "Foam," she said. Jenna placed the canister in her palm. Hanky looked at it as if it might bite. "You sure about this?" he said. "No," she said again. "But I am sure about what happens if we do nothing." She shook the canister once, listening to the components shift. The instructions printed on the side were clear about limb wounds, silent on hearts. Miguel shifted his weight. If you are going to do something that might ruin my day, a heads up would be great, he said. Watch his pressure, she said. If it drops fast, we are changing tactics. She inserted the small delivery catheter between the scar tissue and the pericardial lining, angling it so the foam would expand around the fragment and not toward the lungs. It was a three-dimensional puzzle she had to solve by feel, not sight. Ready, she said. Miguel nodded, even though she could not see him. Riley depressed the trigger, a short, controlled squeeze. The foam hissed softly as it expanded inside unseen. She felt the subtle outward push against her fingers, a living structure reshaping around an artificial presence. She counted under her breath, 2 seconds, 3, 4. Stop, she told herself, and let go of the trigger. They waited. On the monitor, the heart rate ticked up by 5 beats, then settled. Blood pressure held. No change, Miguel reported. He is tolerating it. Riley checked the heart with the probe again. This time, when she touched the area around the fragment, the resistance was different. Less sharp, more cushioned. The fragment still clicked under the probe, but there was give around it. We have a buffer, she said. We get one good shot at this. She had Jenna hand her a fine curved clamp, the closest thing they had to a tool that could grab without crushing. She positioned her left hand so that her fingertips rested lightly on the visible surface of the heart, feeling each contraction. With her right hand, she guided the clamp tip down into the foam-created pocket toward where the fragment waited. The room narrowed even further. All she could process was the rhythm under her left hand and the faint feedback in her right. With each beat, the fragment moved a fraction of a millimeter. She had to time her attempt in the space between. On my count, she said. Miguel, if his rhythm goes nuts, tell me right away. Copy, he said. He is at 92, pressure 90/55. She took a breath. 1, she counted softly with the beats. 2, 3. On the 4th beat, as the heart relaxed, she slid the clamp forward and closed it. There was a metallic contact, a higher-pitched note under the usual thud. She felt it through the instrument like a tuning fork. Got you, she said almost to herself. The heart kicked irregularly. Benjamin, Miguel said. He does not like that. Riley did not move yet. The clamp was closed. The foam around the fragment had to be supporting the movement, or the metal would be grinding into tissue with each beat. Can you hold that, Henka asked. I have to, she said. The monitor blared a warning. The rhythm on the screen turned into a mess of sharp, uneven spikes. V-Tac, Miguel snapped. Pressure dropping, 80, 70, 60. Give him a bolus, Riley said. Charge the defib at 120. Jenna, be ready. She could not let go of the clamp. If she did, the fragment might slip into a worse position. If she pulled at the wrong time, she could slice the ventricle. Miguel slapped pads onto Rourke's chest above and below the field, careful around the drapes. The defibrillator began to whine as it charged. Pressure 40, he said, rhythm unstable. Hit him, Riley said. Clear, Miguel called. Everyone lifted their hands off the patient, except Riley. The shock jumped through the chest, a visible jolt. The heart paused, then stuttered, then found a pattern again, slower, still irritable, but organized. Back in sinus, Miguel said. Pressure 60/40 climbing. Riley felt the new rhythm under her fingertips. It was weaker but steady. On this beat, she said quietly, we are done waiting. She matched her count again. 1, 2, 3. On the next relaxation, she pulled. The resistance was real. The fragment did not want to leave its pocket. The foam resisted in the opposite direction, doing the job she had hoped for, holding the edges of tissue in place. For 7 seconds, the world was only that force, the battle between metal and her arm. Then the clamp came free. A small piece of jagged steel emerged from the incision held firmly between the jaws. It glistened dark with blood under the lights. Got it, Jenna breathed. Blood immediately welled up from the space the fragment had vacated. Packing, Henke said. He pressed gauze sponges into the gap, following with suction. The foam had done its work there too, limiting how far the new bleed could spread. It bled, but not as catastrophically as it might have. Miguel watched the monitor hand hovering over the vasopressor dial. Pressure dipping, he said, 60/30. Keep him full, Riley said. Do not let him tank. She gave the clamp with the fragment to Jenna, without looking away from the field. Save that, she said. We are not losing it. They worked fast. Henke identified the small tear in the ventricular wall where the fragment had been leaning. It was superficial thanks partly to the foam. He placed a row of fine sutures, his hands more confident now that they were dealing with something familiar. Bleeding slowed. Riley checked the pericardial space again, making sure there were no major sources of fresh pooling. They left some foam in place now that it had shown it could help without choking the heart. Miguel's updates became less urgent. Pressure 70/45. Heart rate 85, sat 95. The numbers were not pretty, but they were compatible with life. Riley exhaled slowly. Her shoulders ached from tension she had not noticed building. Sweat gathered at the back of her neck under the cap. Let us close, she said. They reversed their path layer by layer. Suture tie move up. Henke closed the deeper tissues. Jenna counted instruments and sponges, her voice quiet but firm, making sure nothing got left inside. Riley supervised checking each step with a glance. By the time they were placing the final staples in the skin, Rourke's color had deepened from waxy gray to something closer to a tired beige. His lids fluttered once, then settled. Miguel adjusted the ventilator and turned one of the drips down a hair. "We bought him some room," he said. "Now it is on him." Riley stripped her gloves off, snapping them neatly into the biohazard bin. Her hands underneath were wrinkled and pale. A tremor chased across her fingers, then faded. Jenna came around the table, holding a stainless steel basin. The fragment lay inside a crooked shard about the length of Riley's thumbnail. It caught the light in a thin line. "You want to do the honors?" Jenna asked. Riley peered at it. It looked smaller than it had felt. "You keep that with the chart," she said. "Somebody in records is going to need proof this was not magic." Miguel barked out a quiet laugh. Cole pushed through the tent flap, goggles pushed up on his helmet. He took in the scene in a single sweep. Rourke still on the table, still on the vent. The lack of panic. "Well," he asked. "He is alive," Miguel said. "For now, that is a win." Cole's shoulders dropped half an inch. He looked at Riley. "Whatever you did in here, the Colonel owes you another beer. He will never admit to," he said. Riley did not smile, but the corner of her mouth twitched. "He can pay up when he is extubated," she said. Henke pulled off his gown and gloves, face shiny with sweat. "We need to write this down," he said. "Exactly what you did. It is not the Rourke maneuver anymore." Riley wiped a damp line from her temple with the back of her wrist. "No," she said, "it is not." Miguel tilted his head. "So what do we call it?" he asked. For a moment, Riley felt the weight of 8 years of silence. The years when something she had built lived under someone else's name. The weight was real, but so was the sight of Rourke's chest rising and even ventilator-guided breaths. "Call it the Quinn method," she said. The words came out flat without fanfare, but they filled the tent. Jenna repeated them once, testing the shape. "Quinn method," she said. "All right." Miguel nodded. "I can work with that." Henke moved to the small counter where a clipboard waited. He flipped a page to a fresh sheet and wrote in block letters at the top. "Field procedure Quinn method." Riley felt something in her chest loosen. A knot she had kept tight for so long she had stopped feeling it begin to uncoil. "Keep him warm and watched," she said. "He is going to want to crash again." "We have got him," Miguel said. Riley untied her gown strings and stepped away from the table. The air outside the circle of lights felt colder, thinner. She pushed the flap aside and stepped out of the tent. Night had settled while they worked. The desert sky stretched above the base, dark velvet scattered with distant stars. The floodlights created islands of harsh brightness, but between them there were shadows and quiet. The noise was still there, the hum of generators, the distant shout of orders, the occasional clank of metal. It felt further away now. She pulled off her cap. Her hair fell in flattened waves around her face. Sweat cooled on her scalp. Near the tent entrance, a small set of concrete steps led to a makeshift walkway between structures. Riley climbed them and sat on the top step, elbows braced on her knees. Her hands lay loose in front of her, palms up. They were not shaking anymore. A helicopter lifted from another pad at the far end of the base, red lights blinking against the sky. The sound of its rotors rolled over her, less a roar now and more a low, steady turning. She watched it ascend until it blended into the darkness. 3 days later, Riley stepped off a military transport into damp Virginia air that smelled like jet fuel and rain. The runway stretched in gray lines under a low ceiling of clouds. The cargo plane behind her crouched on the tarmac, engines whining as they spun down. A few other passengers shuffled away toward a waiting shuttle, shoulders hunched against the wind. She had a duffel bag slung over one shoulder, the same bag she had carried into deployments years ago. The canvas was more frayed now. The zipper stuck halfway if you did not coax it. A captain in dress uniform checked a clipboard near the bottom of the ramp. His eyes lingered on her chest for a moment, on the lack of insignia there. "Quinn," he asked. "Yeah," she said. He pointed toward a waiting black SUV parked beyond the fence line. "You have transport arranged," he said. Riley adjusted the duffel strap and walked. Her boots felt heavier on asphalt than they had on dust. The SUV had government plates and windows tinted darker than they needed to be. A man in a suit held the rear door open. His tie was perfectly straight, his face politely blank. "Ms. Quinn," he said, "if you will come with us, please." "Am I under arrest?" she asked. It came out almost conversational. He hesitated. "No, ma'am," he said. "You are requested for a briefing." Requested. The word had a soft edge that did not match the way his hand flicked the door handle. Riley climbed in. The back seat smelled like leather and some faint cologne that reminded her of boardrooms. The driver pulled away from the airfield, merging onto a highway that cut past warehouses and office parks. Signs flashed by familiar names she had seen on the news for years. Arlington, Pentagon City. Rain began to spit against the glass-thin drops that streaked the view. Traffic thickened then thinned again as they turned off toward a complex surrounded by layers of fencing and concrete. They passed through multiple checkpoints. Each one involved a different uniform, a different level of inspection. At one, she had to show the temporary badge someone had handed her on the plane. At another, a guard with a German shepherd walked slowly around the SUV, the dog's nose testing the air. No one told her exactly where they were going. They did not have to. The shape of the building that rose ahead at all angles and blank surfaces answered the question. Inside, the air was cool and dry. The floors shone. People moved with purpose, carrying folders and tablets, whispers of conversation, dying away as doors closed behind them. A civilian woman in a navy blazer met Riley at the entrance to a secured hallway. "Miss Quinn," she said, "I am Karen Lee, Office of the Surgeon General. This way." Riley followed her through a set of double doors that hummed as they unlocked. The hallway beyond felt like a different world from the dust and canvas of Coyote Ridge. The walls were lined with framed photographs of past leaders, all of them in formal poses, hands neatly folded flags in the background. Karen stopped in front of a door with a small plaque, "Conference Room 4C. She opened it and stepped aside. The room was not large, but the table dominated it. Polished wood 20 chairs arranged around it. 8 of them were occupied by uniformed officers whose shoulders glittered with stars and stripes, and by civilians in dark suits. A screen on the far wall showed a grid of video feeds, faces from other locations waiting in silent squares. Riley paused on the threshold. Everyone turned toward her. "Ms. Quinn," said the woman at the head of the table. A 2-star insignia sat on her shoulders, silver against dark blue. "Thank you for coming on short notice. Please sit." Riley took the empty chair near the foot of the table. The leather was cool under her palms. "I am Major General Helen McCaffrey," the woman said, "Army Medical Command." Her voice was steady, not warm but not cold either. "We owe you an apology," she said. The word hung there. Riley kept her expression neutral. Part of her wanted to laugh. Part of her wanted to walk out. She did neither. McCaffrey pressed a button on a small remote. The screen on the wall changed. The grainy scan of Rourke's chest appeared first, then flicked to a list of case numbers and outcomes. "When you were in Al-Qadr, McCaffrey said you improvised a field procedure that saved Colonel Rourke's life and the lives of several other soldiers. That procedure was documented in your report. That report was suppressed by your chain of command." One of the video feed faces shifted, looking down. "The decision to bury that report was made to protect careers," McCaffrey said. "Not to protect troops. That is the formal conclusion of our review panel." The words were flat, but there was friction under them. "The technique survived anyway," she went on. "People talk. People teach. Somewhere along the line, your method became informal doctrine. It was renamed, misattributed, and eventually codified as the Rourke maneuver." She clicked the remote again. The slide changed to a bar graph, then to a map dotted with locations. "In the past 6 years, she said this procedure has been used in 4 theaters of operation. It has been directly credited with saving 312 lives. Karen slid a folder across the table to Riley. Her name was printed on the tab in clear letters. Riley did not open it. She kept her eyes on the screen. The dots on the map pulsed gently, nestled in countries whose names she knew too well. "You deserved recognition," McCaffrey said. "You did not get it. You deserved to make informed choices about your career. You were not given that chance." She let that sit for a moment. "We cannot give you back those years," she said. "But we can tell the truth now, officially." Riley's throat felt dry. "Why now?" she asked. McCaffrey looked at her directly. Her eyes were a sharp gray. "Because suppressing the truth is costing us lives," she said. "And because Colonel Rourke refused to stop bringing your name up in every briefing, every after-action review, every time someone mentioned that maneuver." One of the video squares on the screen showed Rourke himself propped up in a hospital bed. A nasal cannula delivered oxygen. Lines ran out of sight. His hair was messier than she had ever seen it. He lifted a hand in a small salute. "Hey, Quinn," he said. His voice carried the scratch of recent intubation. Riley blinked. "Sir," she said. McCaffrey cleared her throat. "We are offering you reinstatement," she said. "Active duty, rank of major with time and grade adjusted. You would serve as Director of Tactical Medical Innovation, overseeing development and training of forward field procedures. Full back pay from the date of your discharge. Full benefits reinstated." She spread her hands slightly, a measured gesture. "That is the formal part," she said. "Informally, what I'm saying is we want you back. And this time we will put your name on what you build." Riley let the words roll over her. It was a lot. Rank, title, chains of command, offices and budgets and authority, a seat at the table that had once decided she did not exist. A movement at the far end of the table drew her eye. Dr. Gregory Hale sat in one of the chairs, his hospital ID clipped awkwardly to the lapel of a suit that fit him less perfectly than his usual white coat. He looked smaller outside his own office, paler. His hands were clasped too tightly on the tabletop. "Ms. Quinn," he said. Hearing him use the same formality here felt wrong, like he was putting on a costume. "I represent St. Bartholomew Medical Center," he said. "I was asked to attend when your name came up." Riley said nothing. He rushed on. "We had no idea about your military background," he said. "Your record, your contributions. If we had known, the decision last week would have been handled differently." Her jaw tightened. "Would you have let Linda Carr die first?" she asked, and then fired me more gently. A small muscle jumped in his cheek. "We acted on the information we had," he said. "We acted to protect the institution." "You acted to protect yourself," she said. The room went very still. Even the quiet beeps from the equipment in Rourke's video square seemed to fade. Hale's eyes darted to McCaffrey, then back. "St. Bart's would like to offer you reinstatement," he said. "With promotion to Chief of Emergency Medicine, full authority over protocols in the department. Whatever resources you need to continue your work." Riley looked at him, at the man who had slid a termination letter across a desk, while a woman he had never met slept downstairs because Riley had refused to wait. "You fired me for keeping a patient alive," she said. "You called that reckless. You told me my instincts did not override protocol." Hale opened his mouth, but she raised a hand slightly, and he closed it again. "Now you want me back," she said, "because somebody else said I am useful. That is not respect, Dr. Hale. That is fear. Fear that people will notice you threw away someone who turned out to be valuable." Color rose up his neck. He had no answer that did not condemn him further. McCaffrey watched Riley, not interrupting. The others in the room stayed very still. Riley finally turned back to the general. "I appreciate the apology," she said, "and the offer, truly." Her gaze flicked to Rourke on the screen. He was watching her eyes clear. "You taught that procedure in secret because you thought it mattered more than your own record," she said. He gave a small shrug that tugged at his lines. "Seemed worth the trouble," he said. "There are a lot of people like me," Riley said, returning her attention to McCaffrey. "Nurses, medics, paramedics. They see things before anyone else. They make calls without time for a committee. They get punished when the call does not fit the paperwork." She shifted in her chair, fingers tracing the grain of the table. "I went to St. Bart's to get away from this uniform," she said. "I watched the same patterns play out in civilian clothes. Different acronyms, same fear of liability, same habit of silencing the people closest to the bleeding." McCaffrey's expression did not change, but she listened. "I could come back," Riley said. "Take the rank, take the office. I could try to change things from inside with memos and directives and training schedules." She paused. "Or I could do something else." "What are you thinking?" McCaffrey asked. Riley inhaled slowly. "I am thinking about a place where people come to learn how to do the work when there is no one to tell them what to do," she said. "A center that is built for frontline medicine. For nurses and medics and physicians who actually hold the compressions and the needles." She looked down at her hands resting on the table, then back up. "I want to teach them what no textbook covers," she said. "How to trust the knowledge in their hands without discarding evidence. How to walk the line between protocols and reality without falling off either side." One of the civilians spoke up for the first time. "That sounds like a private initiative," he said. "You would leave both systems entirely." Riley thought of the board in the staff lounge, Naomi's picture framed under fluorescent light, of a beige room where she had been told to sign her name to silence, of a dust-filled courtyard in Al-Qadr where she had pulled a man back from the edge with nothing but a tube and stubbornness. "I left the uniform once," she said. "The system followed me anyway. Maybe it is time to stop running from it and just step sideways." McCaffrey considered that. "If you build this center," she said, "if you design a curriculum, we can send people. Officially, we can fund seats, we can recognize the certifications." "That would help," Riley said. Hale shifted as if about to speak, then seemed to think better of it. Rourke cleared his throat on the screen. "Quinn," he said, "whatever you decide, I am in your debt, twice over. If you need an old man to tell war stories to your students, I have a few." Riley felt something loosen in her chest. Not forgiveness exactly, not closure, just a little more space to breathe. "I will keep that in mind, sir," she said. McCaffrey closed the folder in front of her. "Consider the offer open," she said. "If you change your mind about the uniform, my office will answer your call." Riley stood, the chair legs scraped softly on the floor. "I think my days of saluting are over," she said, "but I appreciate knowing someone will pick up if I need help." She looked down the table at Hale one last time. "You have a department to run," she said. "I hope you remember what it looks like when someone puts the patient ahead of your comfort." He dropped his gaze to his hands. Karen appeared at her elbow. "I will show you out," she said. In the doorway, McCaffrey's voice reached her again. "Miss Quinn," she said. Riley glanced back. "Thank you," the general said, "for what you did out there. and for making us face what we did here." Riley gave a small nod. Then she walked out of the conference room, down the polished hallway with its framed portraits and silent carpet, and away from the table where other people had finally spoken her name out loud. 6 months later, the old warehouse on the edge of Denver did not look like much from the outside. The brick was still chipped in places. The loading bay doors still bore faded numbers from some long-gone shipping company. A new sign hung over the main entrance, simple black letters on a white background. Quinn Institute for Frontline Medicine. A gust of wind rolled down from the foothills carrying dust and the faint smell of snow, even though it was only October. Cars filled the improvised parking lot, a patchwork of sedans, pickup trucks, and 1 or 2 battered ambulances that looked as if they had come straight from a call. Inside the warehouse had been carved into rooms with drywall and glass. The main training hall took up most of the space. Rows of folding chairs faced a low platform. Portable monitors blinked quietly at the back. A bank of mannequins lay on gurneys along one wall, plastic chests rising and falling in slow artificial breaths. 200 people filled the chairs. Some wore hospital scrubs. Some wore paramedic uniforms with reflective strips. Some wore fatigues with name tapes that had seen sand. There were white coats over jeans, battered boots, and polished shoes, age lines, and fresh faces. Riley stood behind the curtain, at stage left, one hand resting on the edge of the frame. She could hear the buzz of voices on the other side, the shuffle of feet, the occasional crackle of a radio someone had forgotten to switch off. Her other hand held a stack of note cards. They were blank. Jenna touched her elbow. "You ready?" Jenna asked. Riley looked at her. Jenna wore jeans boots and a black t-shirt with the Institute's logo printed small over her heart. Her hair had grown out a little, softening the sharpness of the buzz cut without removing it. "Ask me after," Riley said. "Too late," Jenna said. "You are on the schedule." She pushed the curtain aside. The noise in the hall dropped as Riley stepped into view. Seats creaked. Someone near the back shifted a bag. Riley crossed to the center of the platform. The lights were not bright, just enough to cut the shadows. A battered wooden lectern waited there. She rested her hands on its edges, feeling the grain under her fingers. She let the room settle. "Good morning," she said. A murmur of morning came back from scattered rows. "I am Riley Quinn," she said. "You already know that. That is why you are here." A few smiles flickered. "In the next 3 days," she said, "you are going to see things that are not in your textbooks. Some of what we do here will make you uncomfortable. That is all right. Discomfort is how you know you are pushing past the edge of what you think you know." She stepped away from the lectern, moving closer to the front row. "I'm not here to teach you to be cowboys," she said. "You have met enough of those. I am here to give you more tools for the moments when the protocol page runs out and the patient is still crashing." On the wall behind her, a screen showed a simple title slide, Quinn Method and Related Field Procedures. No photos, no glamour. "You all come from different systems," she said. "Hospitals, fire services, EMS, military. Those systems do not always reward the kind of thinking that saves lives in a hallway or on a roadside or in a tent with no power. You know that. You came anyway." She nodded toward the rows of mannequins. "We will start with the Quinn Method this morning," she said. "We will break it down into pieces you can feel in your own hands. You will learn when not to use it just as much as when to use it. By the time you leave, my goal is that you will have one more option in your head when everything else is failing." A hand went up in the middle rows. A man in a paramedic uniform with a California patch on his sleeve. "You going to tell us the story of how you came up with it?" he asked. A few heads turned his way, curious. Riley thought of the dust in Al Qadr, the smell in the tent at Coyote Ridge, the conference room with polished wood and power. "You will hear parts of it," she said. "But today is not my war story. Today is about yours. The day the chopper cannot fly because of weather. The day the CT scanner is down. The day the surgeon is 30 minutes away and the bleed is not." She let that sink in. "Grab a notebook," she said. "We are going to get specific." The rest of the morning smelled like latex and coffee and the faint tang of marker ink on whiteboards. Riley moved through the hall demonstrating on a training torso how to track a needle between ribs, how to feel for landmarks under skin, how to read a body with more than your eyes. Her hands guided other hands adjusting angle and pressure. "Not there," she told a flight nurse from Montana, redirecting her grip by a fraction of an inch. "Feel this ridge slide off it. There. That is your window." Miguel took over in the afternoon for a session on managing pressure and sedation in the field, his dry humor cutting through the numbers. Jenna ran a breakout on documentation that did not get people fired or court-martialed when they did what they had to do. Riley watched from the back for a while, leaning against the wall. Seeing other people carry pieces of the work made her chest ache in a different way. Less burden, more weight shared. During the lunch break, a few students lined up to ask questions. One of them, a young ED nurse with a Boston accent, lingered until the others had peeled away. "How do you deal with administration that does not get it?" she asked. "When they tell you to stand down and your gut says you are losing the patient." Riley thought of Hale of the tidy office and termination letter. "You document like a lawyer," Riley said. "You study until your gut is not just gut, it is pattern recognition, and you decide who you can live with disappointing, more the patient or the person who signs your paycheck." The nurse swallowed, then nodded. "Thank you," she said. By late afternoon, the chairs had shifted from tight rows to clusters. People leaned forward, sleeves pushed up, forearms marked with pen lines where veins and arteries had been sketched for emphasis. The room felt less like a classroom and more like a workshop, loud and alive. When the last session wrapped, applause rolled through the hall, rough and uneven but sincere. Riley stepped back behind the curtain as the crowd began to spill out, conversations already forming. She made her way to the small office carved out of one corner of the building. The room had a second-hand desk, 2 metal filing cabinets, and a window that looked over the parking lot and the scrubland beyond. On the wall above the desk hung a frame patch. Phoenix 7 wings in flame, 7 stars arcing above. Under it, a small plaque. In honor of those who refused to be erased. Riley sank into the chair. Her muscles complained. The fatigue was different from a night in the emergency department, but it settled in the same places. A stack of mail waited in a tray. She picked up the top envelope. The return address had a military postmark. She recognized the handwriting. She opened it carefully. "Quinn, I am being retired whether I like it or not. 28 years in uniform. Feels strange to have someone else make that call. I hear you are building a place where people learn how not to die while they wait for us to figure out what they are worth. Sounds like something I want to see. If you can use an old colonel who knows how to listen and shut up when someone else knows better, I would like to help. Rourke." Riley read it twice. The corners of her mouth lifted, not quite a smile, but close. She pulled a blank sheet of paper from a drawer and picked up a pen. "Jack, orientation is on Mondays. Bring your scars. The students will need to see what survival looks like. Quinn." She folded the note, slid it into an envelope, and set it on the corner of the desk to mail later. Another envelope caught her eye. No official stamps this time. Just a shaky ballpoint address from a town in Colorado she did not recognize. Inside a single page. "Miss Quinn, I am a paramedic in a 2-truck service out in the mountains. Last week we had a logging truck roll off the highway into a ravine. Took us 20 minutes just to get down to him. He was pinned, chest crushed, no way to fly him out. I used what I saw in that video of your method. Not all of it. Just enough to buy him a ride back up the hill. My hands were shaking at first. Then they were not. He is in ICU in Denver now. They say he has a shot. Thought you should know. Thank you. Evan." Riley set the letter down gently. Liam's photograph sat propped against the base of the wall just left of the monitor. She had not hung it yet. It still felt like something she needed to be able to pick up. She reached for it now. The 17-year-old in the picture grinned at her through time, hand on the old truck. The road behind him was a strip of rural 2-lane, the kind that blurred into fields, the kind where help sometimes took too long to find you. She remembered the feel of his fingers in hers as he bled on asphalt sirens faint on the horizon. The helplessness had settled in her bones that night like a promise she had not chosen. She set the photo back in its place. Outside the window, the light was sliding toward evening. The sky had that high, clear-quality Denver god in the fall, blue deepening at the top. A helicopter moved across it, small at first, then larger as it passed nearer to the Institute. Life flight, white and green rotors chopping the air in a steady beat. The sound reached her a moment later. The familiar thrum slid through the glass and into the room, into her chest. It did not freeze her lungs this time. It did not pull her back to a blast wave or a rooftop or a hospital corridor. She watched the helicopter cross the sky, banking slightly as it turned toward the big hospital downtown. Its lights blinked red against the growing dark. Riley stood and moved closer to the window. She rested her fingertips lightly on the glass. Her reflection overlaid the helicopter for a heartbeat. Then it moved past and away. The sound faded. In the parking lot below, a few of the students stood near their cars, animated in conversation. One of them gestured with his hands, tracing lines through the air the way people do when they are explaining anatomy without a diagram. Riley let her hand fall back to her side. She turned off the office light. The room slipped into shadow, leaving the patch on the wall and Liam's picture outlined in the last of the day. In the hall outside, someone laughed. A door opened, then closed. Footsteps echoed. She stepped out, pulled the office door shut behind her, and walked toward the sound. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story. I'll see you next time as we continue exploring more journeys and lessons together.